I realized like there was an appetite for it, even if people in power, people who are decision makers, this scared them because they knew the more information people had, they would want to see structural change both internally and externally. And that's terrifying. And so once I realized that that could put fear in people, I realized that that's going to be my role. And if someone else is saying it, or if I'm not in a position to say it because I'm in a more vulnerable spot, I have to support them when they're standing up. So it might not be me today. It's you. You start speaking. I'm going to start putting stuff in the chat. I'm going to come off mute and say, I agree with him. I'm going to say, so what do you think about this? I know we were talking about this the other day and really bringing it into the spotlight in a group way, because some of these topics, people will try to break you down. But when you're standing as a group of people, it's much harder for folks to kind of nitpick and tear away. And so
this is the Public Health Millennial Career Stories podcast, where you'll hear about diverse career stories, career strategies, get tips, and learn from others to help you in your public health career journey. If you want to learn about public health careers, or just hear public health stories, stay tuned because you won't want to miss this. Welcome to the Public Health Millennial Career Stories podcast, episode number 102. Hi everyone, Omari Richards here. Thank you all so much for joining me. Be sure to follow me on Instagram if you have not as yet at the PH Millennial. Be sure to subscribe to this podcast or subscribe on YouTube if you have not as yet. That greatly helps. Leave a 5-star review. That helps to get people and get the show out to more people, as well as show people why you enjoy this show so much. And be sure to support. You can buy some clothing from the store at thephmillennial.com, and you'll find the store tab there, or you can go to thephmillennial.com/support and find different ways to support there. I thoroughly enjoyed today's episode. This was a really refreshing conversation. I gained a lot, and I think that you all are going to gain a lot from these insights. I love her perspective, and I love how she was able to navigate her career to really get that trajectory really early on, even though it wasn't intentional. But I think there's amazing insights in here, and this is definitely someone that you would want to connect with. So enjoy. Today, we have a motivated public health practitioner with a background in health policy and health equity. She is committed to amplifying trauma-informed approaches via working alongside communities and diverse stakeholders to aid positive health outcomes through addressing the social determinants of health and promoting equitable anti-violence strategies. She got a bachelor's degree in political philosophy and public policy at University of Massachusetts, Boston. She then got her master's of public health at Boston University School of Public Health. She is currently the Associate Director at the Boston Public Health Commission. We have Alyssa Benalfew-Ramos, MPH. Welcome to the show.
Hey, I'm so happy to be here. This is awesome.
Yeah, I'm really happy to have you on. I'm really impressed by your career trajectory. I think you've done an amazing job getting to where you are right now, and I'm looking forward to hearing more about your story and your insights and everything like that.
Yes, let's do it.
Awesome. So how are you doing, and how have you been coping during these times?
That's a great question. I mean, I've been doing my best. I think now has been a time because there's always so much going on. And I think for many of us, we have to kind of stay to a degree tuned in to what's going on because it's relevant to our work and our relationships and the people we care about, our communities. And so I've been honestly trying to focus a lot on myself, my physical, mental, emotional, spiritual, and even my social health, me being in connection to my communities, my family, the people I care about. And so I think this time has really just made it even more clear to me that we can't burn the midnight oil at work, we need to be able to find that time to take care of ourselves so we can show up and do the things we want to do, and for ourselves and for the things that we love doing. And we can't do that if we're constantly giving and giving and giving. So I think this whole period for me has been trying to find a balance, and that's been, I would say, working to some degree.
Yeah, well, I appreciate that, and I like everything that you said there, and I think that it is some sort of balance, whether that is balanced in to whoever's perspective of what balance is. But yeah, we need to find our own way of doing things and not burning out ourselves doing this work, because as you said, we have to be we have to like be full in order to give the most that we can give. So I appreciate that. And I also appreciate you like mentioning all the different aspects and factors that go into health, because sometimes you don't think about all those like connections and spirituality and all of those other aspects. So appreciate that as well. So how do you identify, and then tell us a little bit about your personal background?
So I am Alyssa Benalfew-Ramos. I use she, hers pronouns. I'm from Peabody, Massachusetts, which is a small suburb outside of Boston. And I currently live in Boston. I've lived here for about the past 5 years. I'm Jamaican and Ethiopian. My mom is from Jamaica. My dad is from Ethiopia. Both of those mean incredibly much to me and everything that I do and how I present and how I kind of see the world. And, I grew up in a predominantly white town before moving to Boston. So I think that was also one hell of an experience, and then transitioning into doing some work that I'm really passionate about. I think I couldn't be on here to talk about public health without talking about my aunt. I had an aunt several years ago now. She passed away due to some very rare form of cancer that like no one in the world has. I think when she had it, about 5 people in the whole world had that type of cancer. And my mom was her healthcare proxy. And so that meant my mom was always bringing me to her doctor's appointments. Luckily my aunt had decent health insurance because of her employer. And so she was able to get care from Mass General Hospital and other like well-renowned facilities. And so just being in that setting all the time growing up, I knew I wanted to do something related to health and public health or medicine, healthcare adjacent, but I wasn't really sure what that was or who knows what public health is before you get on the inside. And so I think for me, I was always having that kind of tension there as well of like, what do I want to do? How do I want to do it? And until I found public health, I was kind of more aimlessly just doing things I was interested in. And so to this day, I really think about my aunt as I do public health because to me, it's where we live, work, and play. It's who we're in community with. It's who we show up for, and making sure that people have access to accurate information so they can make well-informed decisions about their health. And we know that there are barriers such as like racism and classism and a whole bunch of other things that get in the way of that, xenophobia, especially thinking about my family. But I think she's the reason why I started public health, and I see her and constituents and colleagues, and I think it's really important that we have our why. Like, why are we doing this? So she's a big reason for my why.
Yeah, that's awesome. Well, shout out to your aunt. Hope she is resting in power, resting in peace, and I'm glad that that though very sad and an experience opened you up to opportunities in the field of public health. And I'm guessing when you were younger and going through this, you had no clue it was public health. And I'll ask a little bit more about that.
What is public health?
exactly right. And we'll get into more about how you found out about public health. I'm guessing. Also, don't want to miss out on the part of Jamaica and Ethiopia. That food must be amazing at home. So I'm gonna just put that out there. Like, if you ever need someone to eat some food, just holler at me. I'll be there.
You're more than welcome. Honestly, I love food. And so that's another one of the things I try to make sure I maintain is all of my recipes. That's also another self-care thing for me is taking time to really just be in the moment when I'm cooking. And so yes, food connection, we could do that.
Awesome. Good to hear. So what does public health mean to you?
So some of this is going to sound a little close to my last answer, but to me, it's really, I think about public health as the social determinants of health. Like, I really do think about where we live, work, and play, what factors influence our health, what could make our health better, and what, might harm our health. And I think when we think about health, oftentimes these definitions from World Health Organization or CDC or these other institutions, they often talk about like attaining your fullest health potential. And I think that's really important. And we have to acknowledge where that isn't possible due to these systems of oppression, I'm just going to come right out and say it because this is how I talk in my work all the time, white supremacy. Like certain things just don't allow people to be healthy. And I think a lot of public health over time, first it was around preventing the spread of disease and sanitation. Then it was about providing direct care and clinical services. And now we're in this age of like getting people access to health care and affordability and availability of services, but not just health, but also social services. And so I take this more expansive, like historical view of public health, where there have been wins, but when you look into the past, there have also been things that have been very terrible and tragic and devastating to Black and Brown communities. And so for me, it's every day when we're thinking about public health, how are we creating systems and institutions and programs that are providing access and, you know, really meeting people where they're at, like taking the equitable approach, but also just not stopping there. Like, what can we do? Can we give money directly to people? Can we involve them directly in the decisions that impact their health? I don't think I'm the person in the room that's going to say we need to do some community engagement, or it might be easier to do it this way, but this is what we said we were going to do. And so how are we going to make that happen? So for me, public health really is about acknowledging its history and its current ways that it harms people. And what can we do right now? Because people still need help and institutions are made up of people. And so if we can't gather and do culture shift within organizations, how are they going to best meet the needs of their client and not just bottom line or to say we served this many people last year, because that's not going to move the dial in communities. So the people in the communities know best, and that's public health.
Yeah, and this is why we need more people like yourself in these rooms to advocate for the community voice. And I think it's important, as you said, like these things have been happening this way for a while because that is the status quo. And if we don't come into meetings and speak up and say, okay, let's get some community voice and some community input onto it, things are going to continue to be the same because the systems aren't going to shift. So really the first step is like educating and speaking up and taking the power that we do have and using that to raise the platform of the voices that have been unheard. So yeah, I appreciate you there a lot. And there's something that I'm going to ask, but I'm going to ask it later on when we get to you working in your current job as well. Okay, awesome. There was also something. So in your intro, it goes on to say like, and promoting equitable anti-violence strategies. That's not something that you typically hear people talk about. So I don't know if you wanted to like just talk a little bit about that before we get into your career story.
Oh, totally. I would say violence is one of the worst things as human beings that we could do to one another. And it's been happening since the beginning of time. I think, you know, in undergrad, I studied political philosophy and we talked about Hobbes, Locke, and Rousseau. Like what happens at the beginning of society when we're all, not all, there's a couple of people, limited resources, and what happens when we need to create a rule or set a boundary or someone is stealing your stuff for their survival. How do we come together? And so violence has been a constant, and especially different forms of violence in our community. When I say our community in this context, I'm going to speak specifically about like Black and immigrant communities. There are many different forms of violence I think don't get addressed, and people don't receive services for them in the way that maybe white or middle class folks are able to. And so I'm talking about like community violence and harm. I'm talking about intimate partner violence. Really thinking about domestic violence as well, and how oftentimes, especially through media, people make like jokes and memes out of things that are really terrible. And in some way, I could see that as a coping strategy. In another way, it's like there's so much complex PTSD, I believe, in our communities due to unaddressed violence. And we know that violence comes from a structural root cause. It all comes back to white supremacy and this idea of scarcity and limited resources when that's really not the case. And so I think thinking about equitable anti-violence strategies, like what do people need? What education, similar to what you were saying, how do we raise people's consciousness? How do we provide services that aren't within certain parameters? Like you have to fit this exact criteria to be able to receive services here. Like, ooh, that person, you know, maybe was straw buying, which is when you have a woman purchase a weapon for someone who's not allowed to have that weapon. And now this young woman is in trouble, and with the law, she should be able to access services. She's in a harmful situation. And so I think also not taking a view that one gender might be committing violence more than another, but seeing how are we meeting people where they're at and really providing strategies and solutions and funds when those situations are needing them.
Yeah, absolutely. Well, I appreciate you sharing that, and I appreciate you putting that in your LinkedIn bio so that I could read that. That we could that you could chat more about that, because I think it is important, especially in our communities, Black BIPOC communities for me.
Yes.
because yeah, there are a lot of these structural issues in the family structure and in the social norms and cultural norms that aren't spoken about, and we don't like just mental health, for example, is something that roots out of a lot of like violence that happens that people don't talk about, or like unresolved traumas and different things like that. So just having a place where we can chat and just raise this up and have people know that it's okay to talk about this, and this happening to me is not okay, and these are places I can get resources, and how can I get out of this safely, and on all these different things are important topics that aren't spoken about enough. Well, I guess they are more so now, but still there still needs to be some more that's raised and up in that. So I appreciate that as well.
I agree.
Awesome, awesome. All right, so going into your undergrad, you got your Bachelor's of Arts in Political Philosophy and Public Policy at the University of Massachusetts in Boston. So what was the thought process to getting that degree?
So this is where I disappoint everyone. So I opened the course catalog as a freshman, and I was like, what seems interesting? I don't know what I'm doing here. And so I read that that was going to be about policy creation, kind of the why things are the way they are, like how does the government operate, but not even, I wasn't thinking big government. I'm thinking like local city government or state government, like how are resources allocated? And I think the political philosophy piece, because it's like a joint degree that they kind of smashed into one degree. To this day, I don't know if it's one or two, and no one ever gave me a clear answer. But the political philosophy side was like moral issues of medicine and bioethics and classes around, yeah, I guess just a lot of ethics and foundational texts. Like we read Martin Luther King. That was the first time I ever read Martin Luther King in a classroom, or that wasn't the I Have a Dream speech. Like we read like the letter from Birmingham jail and other pieces, or we learned about critical race theory, something I never thought would be coming back up in any other context. So that was several years ago, more than about 7 years ago now. And so I just found that those classes were engaging, they were enriching, but all along the way, I was trying to connect those dots back to health. And so I'm like, ooh, this moral issues of medicine class is very interesting. How do we connect that to other things I want to study that aren't specifically biology, for example, because I ended up taking biology too. So, but I really appreciated trying to find my way. And I think UMass Boston had a lot of great courses. It's a really unique school because it's a lot of people who are first generation college students, veterans, families, people, parents with children. It's just non-traditional in many, many ways, a lot of international students. And so just the culture of being in such a place where there are folks who are rather transient and like being able to create a community and take these classes, it was really special.
Okay, I appreciate that. And going into this, picking this degree, did you have an idea of like what you were thinking you would do after you graduate, or not so much?
Not at all. And to be honest, my dad is African. So he was like, why aren't you trying to become a doctor or a nurse or an engineer or at least a lawyer? I thought, like, given your interest. And a lot of people who studied for this degree, they did go to law school. And so I was like, oh, maybe I'll go to law school. But I wasn't super passionate about the idea of practicing the law. Like I wanted to know it. I didn't want to have to like memorize it. And what's the precedence for everything that's ever happened? Like that just didn't seem where I wanted to go. So I was basically undecided until the middle of junior year and did not have a plan.
Okay, makes sense. I think that's not very atypical. I think a lot of us don't know what is going on in undergrad, and I think that's fine for the most part. For the most part. Okay, so one of your positions during undergrad was an orientation leader at the Office for New Students Programs at the University of Mass Boston. So tell me about that. And I think you also got promoted into assistant coordinator position or shifted. So you could tell me about that and then the transition, and then we could go from there.
No, sounds good. I had a really great orientation leader at my orientation. And because I kind of stumbled into going to UMass Boston at the last minute, this orientation leader left an impression on me. And so a couple weeks into the school year, they were doing kind of like a jobs fair, on campus jobs. And the same person was at the table trying to get folks to sign up to work as an orientation leader. And to me, it was super fun. We got to work with groups of 20 to 30 students at a time, tell them all about the campus, identify the resources. But a lot of being an orientation leader back then was like we're gonna play ninja, we're gonna play games, we're gonna like get to know each other, like the corny icebreakers that people still don't like that we bring into meetings, but ones that involve a lot more like physical activity or bringing students outside by the water. UMass Boston has a beautiful campus, and so it was a lot of fun, but it also educated me because my mom eventually got her bachelor's degree. It took her a while. She also had to work several jobs before I was born, and my dad never finished college. So neither of them had an idea of like what I was going to be doing in college. So by being an orientation leader, I was like, okay, word. I know what services the library has. I'm making relationships with all these different offices. I know where to get my resume checked. Like that was like my tutorial, my how-to guide was becoming an orientation leader, like right off the bat. So then I became an assistant coordinator because orientation happens in waves. So there's summer, there's like the fall activities, there's the winter stuff, there's the spring stuff, and training people for summer. So I just really wanted to get more involved in like the back end, the logistics, the planning, the scheduling. It's like event planning. We're gonna have an event of 350 people, students, parents, the speakers, who are all the different audiences, how do we support them? So I really like that behind the scenes piece, and I had a lot of fun doing it.
Yeah, and it sounds like it also like helped bridge the gap for you of like finding out where the resources were, as well as being that bridge to new people finding out where the resources were, which is always dope to be a plug. So shout out to you for
I
that.
was the plug. I was the plug. If someone needed to know things, it really, at a certain point, I will say, I ended up on like a billboard campaign for UMass Boston. It was like hashtag my first choice, and like I was really involved with like, it was a 50-year anniversary. So people really knew me. So I would get texts like, Alyssa, I'm going through this situation, like, or Alyssa, I need to find a bite to eat. What's still open? And I always had the answer. So I really loved UMass Boston. I want to be able to have the time, the energy, the bandwidth to give back so other students can be able to like find a home, especially those whose parents, didn't have the easiest journey coming to this country, or, trying to have their own, like take care of their families. So yeah.
Yeah, absolutely. And just relating this back to like public health students, getting some insights here. I think like people reaching out to you and wanting help from you was a factor of you being the person that was out there who collected this information, who knew the information, who was doing these things to give the information. And I think a lot of people, a lot of students, a lot of professionals want to be known for something, or want to be that person that people reach out to, but you can't be that person unless you actually know it and you're actually like engaging and helping people and knowing where the resources and connecting them. So I appreciate that.
Thanks.
You're welcome. You are also an Inspire Facilitator at Office for Student Leadership and Community Engagement. So tell me a little bit about that one.
Yeah, so this really stemmed from some of the stuff we were doing within, I'm going to call it OSLICE, Student Leadership and Community Engagement. There was a lot of volunteering that took place out of that office. They would bring us to different areas in the community for days of service, and they had extended trips that we would go on to provide community service in a different location. And then there was the Inspire facilitation team. It was leaders from all over campus who wanted to talk about civic education, how to talk about, gender identity and pronouns, even back then, which I thought was really cool. People who wanted to talk about racism, people who wanted to talk about what I didn't know before, but like being trauma informed. And so I think we took like a leadership training and a facilitation training and went on a retreat. And then we were able to do some facilitation on campus, but that was more of like a student group within an office. And so it didn't take off in the way that I kind of wish it would. And, got to tell the truth, unfortunately, was one of the people who helped start it did end up passing away, like unfortunately during that time. And so we kind of had to, that was a really big deal for a lot of us who were involved on campus. And so that kind of hit a pause button, but I'm really proud of the work we were able to do and what we were able to share with students, because they would want to come to our sessions and they would want to learn more about these topics. So to me, it just kind of connected more to a lot of the other things I was already doing on campus, but I'm glad that we had that kind of time together.
Okay. And then you were a research assistant at Women and Gender Studies Department. But for all these opportunities here, what was this like by your junior year you started getting involved, or were you involved from your freshman year? Tell me more about that first.
Oh, so the freshman orientation leader thing was the springboard, because I was the orientation leader, one of 30 or something orientation leaders, and then one of 4 coordinators Then I worked also within the College of Liberal Arts first. It was a student success program. I had joined as a freshman because, again, I had no idea what college was going to be about. And they also were connecting people to resources, doing resource sessions, job fairs, resume workshops. So it's almost like I got double duty of being a participant, but also someone who's able to provide the information to others. And so I was very involved from there. And I think the pivot to research and gender studies to have that research assistantship was the turning point of me saying, okay, I want to do things that are health related. And I don't know how to get from where I'm at with this to studying public health, but I need to get some opportunities lined up because they kept saying internships, assistantships. So this was kind of that moment for me. And that was also the time right between like sophomore and junior year where I discovered the, what's it called? They created like a health minor. It was like a history of health minor, science, medicine, and society, past and present. And it was like a pilot kind of minor that was taking place. And it had a bunch of classes from the history department, philosophy. The honors college started offering public health seminars. I took immigration health, global health, biology of human disease, and a couple other courses. So all of these things were starting to almost like get married junior year. And so doing that research assistantship, I was going to like Harvard Medical Library and working with the librarians to find information about, I believe, access to abortions in the 1800s. And my professor at the time was writing a book and wanted this research for her book. And so I will say that was my first experience with research kind of in that qualitative hands-on way. And I did not know, or I wasn't prepared at the time, how much time research is just reading alone. And so I spent a lot of time, I think I did that for more than a year, just reading all of these texts and learning about primary source texts and just the respect that we need to pay within kind of the field of history and like why details matter, how people document their lives. Because so much of it came from unlikely sources. It wasn't like, oh, I just opened the medical textbook. Like, no, this is some physician's journal entry, and this is some woman's letter to someone that she wrote, and it went over here. And so it's really interesting, but I think that sparked my interest in qualitative research, but I still didn't want to be a researcher. So again, all of this was me testing out different experiences to see what's going to be the thing that I am excited about, that even when I have to read 150 pages in a day, that's going to be something I want to do.
Yeah, and I think it's important that you highlight that this testing phase, because I think that's important, especially if you have no clue what you want to do, or to your point, like you're doing this work and you know you're doing like this work that's cool around society and things like that, but you want to incorporate it more into the health, but not in a quantitative research way, not in a medicine way. So testing is really like the best way, or one of the best ways to really get a handle of that. You did say that you went to public health seminars or webinars or something like that. So when did public health as a word, as a topic, as a field come up for you?
That's a great question. We're going to talk about Google search because I was taking these philosophy classes. I'm like, moral issues of medicine. This makes so much sense to me. I was taking foundational something of public policy. That made sense to me. I was taking a class, This Land is Your Land. It was like a history of American medicine. And then also another class that was around specifically, yeah, I guess it was another like history of medicine style class that had to do more with like advances in medicine. So if we're thinking about like antibiotics or penicillin or things like that. So I was getting really deep in the history. I'm like, how do we apply this in real life? So I started a lot of Googling. I started reading thinking about graduate programs, thinking about, I went on the Bureau of Labor Statistics, like all of these sites I know we all aimlessly have Googled before, and seeing like, okay, so what all falls within the bucket of health? No, not an occupational therapist. No, not things that are more clinical, and kind of going down the list and researching each one. So I think behind the scenes, I had like a running note on my laptop that was, okay, what are these different careers? And that's the time also that I started doing informational interviews, which I was terrified because I never used to be, I always had a big personality. I consider myself an ambivert. I'm half and half. But putting yourself out there, going to guidance counselors, or that's not what they're called in college, advisors. I had an advisor in my minor. I had an advisor in the honors college. I had the advisor for my major. I had a general advisor within the College of Liberal Arts, and I would take the advice that one of them gave and I would shop it to each one. And I'm like, okay, y'all, you're gonna help me figure this out. Like, who do you know? What do you know? Like, I even went and spoke to some folks in the College of Nursing, science and math. And I'm like, hey, what does all this mean? And I think starting with those cold conversations, I started getting more practice. How do I pitch myself? How do I talk about my resume, my interests? You know, I haven't really done much yet. How do you talk about wanting to do things and do it in a way that's convincing and compelling? And so all of that time, I just knew I was working towards something, and the strategies I was told around the informational interviewing and keeping notes and documenting things and doing kind of that personal research as well. Those were the tools I was told that would work in terms of me finding a career. And so, you know, they actually did. And I wasn't, when you're in that moment of confusion, it's almost like you're in limbo. Like, why do these courses matter? Why do I have to stay up late and like do these extracurriculars or do these internships, which are very important? And I learned a lot, but in the moment it was like, what am I doing? And so I'm really glad that, especially BIPOC professionals of color, that was redundant, BIPOC professionals, they were really able to provide me with, they would take time out of their day and say, let's talk about this more, let me tell you about myself. So I want to be that person for others because they were instrumental. I wouldn't be here without them.
That's awesome. That's awesome. And I love your first saying, like, you're testing out different positions, trying to see what like different things are doing. You take it to another level, let's start doing informational interviews and start talking to people. And I think in that you realized, okay, this is awkward, this is weird, I don't really like talking about myself. But then
Yep.
through that, you were able to like hone that skill of pitching yourself and saying your value proposition and just hearing more about people. And I also don't want to miss the point of you going to the Bureau of Labor Statistics and just going through different roles and things like that, because I think like that's like the obsessive nature that I kind of had as well when I found out about public health. And I think it's needed, especially to hone down and really figure out what you want to do if you have no idea, because in public health it's just so broad and there's so many different roads and paths you can take. So yeah, shout out to you for taking those steps. That's awesome.
I mean, Omari, one other thing, not to be crass, but also how am I going to make money doing the things that I care about? Because I want to do things. I want to go places. I want to be able to provide for myself. I think a small goal at the time was like, I want to have my bills on auto pay. How can I make enough money to have my bills on auto pay? And so for me, it was so many people telling me that I'm studying just blanket philosophy, which wasn't really true, but I'm studying philosophy. What am I going to do with that? And putting that pressure on. And so I also wanted to pursue opportunities that were going to, compensate me what I thought was fair, even as a young person. So that's an important thing for people to think about. And I think we often don't talk enough about money.
Yes, I would 100% agree with you there. And I think that is a huge consideration to take into account, both on the loans and side, as well as like what is the earning potential and the trajectory of that earning potential, to really understand what type of loans you should get, if any, and all those good things. But yes, thinking about the money is always important, because as we know right now, gas prices are crazy, inflation is crazy. People need money to live and survive and do all the things. And yeah, so yes, we appreciate you sharing that.
Yeah.
Important part of life. Okay, so you're also a peer mentor for this CLA or CLA First and CLA First program senior peer mentor. So tell me about that.
Oh, that was my opportunity to work more one-on-one with students. So I had received the peer mentorship component as a freshman, and they created like a sophomore program that was more around, taking some, I would say, more challenging courses, as well as building connections and doing some more career prep, like career and leadership prep. So being a part of that, I was like, oh, this orientation thing is great. It might be time for me to move on. I've been doing this now. I think at the time it had been like 2.5 years. So I went back to my supervisor and said, the woman who runs the peer mentorship program, like, can I get more involved? And she's like, this is great. You're going to be the senior peer mentor. I'm hiring 2 of you. You can start as a junior. Let's do this. So I was really grateful to have that relationship with her. She was one of the people who helped me through some of the hardest times in college. Like, I've cried at her office so many times. And so for her to like hire me just kind of on the spot by me saying, I think I'm done doing what I'm doing, that was really awesome. And I think really shows the value of creating important relationships. And that allowed me to, I was like an office assistant for part of it because I asked for more hours because sis needed to pay her bills and also get her homework done on campus because I had a problem bringing homework home. Like I struggle doing homework at home. So like I need to do it on campus in a setting where people are working. So that really helped. And then the other part of my job was designing or supporting in the design of co-curricular programs for freshmen and sophomores. So what did I want that I didn't get as a freshman and sophomore is being a part of this program, and what events went really well, what are social things we can do. And so working with the professional staff, that was most of my role. And then I also supported with when the College of Liberal Arts had to do hiring or other things, I ended up on like hiring committees as a student representative or other big events on campus. They would bring in like the student perspective. I was usually in the room for those type of events. So it just gave me a platform, and that platform allowed me to talk more about what I wanted to do, to meet people, to network, and to really support students who, again, most of them were BIPOC, immigrant, you know, trying to figure their own stuff out. And that was the space I knew I wanted to be in. So that was one of the best experiences, just comprehensively, because I was part of it as a participant. And that was right up until the last day of class. And I'll say this, because this is one of my favorite stories. It's very brief. The woman who I said was the advisor that kind of ran this program, I met two other lovely advisors that were basically cool to this day. We still text. And then the woman who ran it, she ran commencement, and she got them to give me a shout out at commencement at the TD Garden in front of my whole family when I wasn't expecting it. And that was really important for my dad because he was like, you didn't become a doctor, but then look, I'm getting university-wide recognition. And so she thought my contributions on campus were worth that. And I really appreciated that moment. It's very special and near and dear to me. So relationships and networking, y'all.
Yeah, that's awesome. That's awesome. That must have felt pretty amazing on top of just like graduating to get that extra boost. And yeah, I guess you deserve it. And yeah, relationships, very, very important. Make those important relationships, as well as the self-awareness that you had to know that you didn't do homework at home. You needed to be on campus. I think that self-awareness is a key part and a huge part in like all factors of life, being self-aware. So yeah.
Yeah, because I wanted to go to grad school. And so I'm realizing like, oh, school does matter. And not that I was playing around before, but I think it was that moment like, oh, so the schools that I want to go to, they want to see this kind of GPA. They want to see these type of experiences. Like I need to buckle down. So that was that like sophomore to junior transition. I'm like, this is the time that I need to make everything count. And like no more writing papers last minute. Like we need to have a process. And so this whole time management, putting things on my calendar, you know, being able to say, I really want to go to this party, but I can't, you know, blocking off periods of time, all of that. Those were when those skills really I started to use them and build off of them. So it always comes back to time management.
Yeah, absolutely. I appreciate you sharing that. So your last position that I have for you in undergrad was an education and exhibits intern at the Edward M. Kennedy Institute for United States Senate. So tell me a little bit about that one.
Yeah. So people who are from New England or many parts of the US, they might be familiar with the JFK Library because JFK was like a national figure. I think people forget about Senator Ted Kennedy. He was in the Senate for, I want to say, about 4 decades. He worked on the Health, Education, Labor, and Pensions Committee. He is part of the reason why we have community health centers here and across the country. The second one, I think, to ever opened in Dorchester down the street from UMass Boston on Columbia Point. And that was, you know, not just Senator Ted Kennedy, but other folks who saw the need for community-based health services because folks weren't getting care at hospitals or couldn't afford it, or geographical distance was a factor. And so I really admired his policy work. And I thought that was one way to make change that people could feel. That's one way to make change that people can acknowledge in their day-to-day lives. And so as an intern, we ran programming, I would say, on the weekends. I only worked on the weekends. We would talk to people about the history of the Senate, the role of the US government, you know, what does the Senate do? Why is it a slow deliberative body? Who's in the Senate? They had these interactive maps that they projected onto the wall that would play on a loop. And so you could see every person who's ever been in the Senate. You could see how does a bill become a law? Certain issues throughout US history, how have they advanced or not? They would spotlight different things like the DREAM Act or other acts that got a lot of movement, but maybe didn't pass in the way that the organizing folks had hoped. And then they would think about current politics and like next steps with a focus on Senator Kennedy's life. And so I think there's a lot to learn in terms of policy as it relates to the Kennedys. And I think, you know, we all have to find our own way. And so like there's things, my dad always says there's things you could pick up from people. And then there's things you got to figure out how to put it in your own words, put your own spin on it and do it. So Senator Ted Kennedy was a big, like, handshakes, we're going to talk about the thing kind of person. And so I admired being able to learn about that, but also teach students, and they would have events and government officials would come and we have to do the speech for them. And so I also learned to interact with people at different levels of society. So they'd have like the owner of a baseball team there, or the cast of a Broadway musical performing at a private show. And they're like, oh, come in, y'all. Y'all are going to be the people working the event tonight. So it was also just kind of this whirlwind experience too, that I got exposed to things I had never seen before.
Yeah, and exposure, as I say many times, is just so important to learning and understanding and experiencing more and wanting more and seeing more for yourself in life. So that's awesome. And I didn't know that the Kennedys were so big on that policy side. So I appreciate you sharing that, and I'll be sure to hopefully remember to put something to that in the show notes so people can do a little more research, a little easier on that as well. Were there any other takeaways that you had from your undergrad experience?
That's a good one. I mean, I think what I would kind of say is not everyone's college experience is going to look the same. I think people get to decide, college is going to be what you make it, especially at a place like UMass Boston. Some of the structure that's built into other colleges isn't there. Like, we're not living in dorms across the street. Side note, UMass Boston has dorms now. But back then we weren't, like, you're not there. So you have to be intentional about the community you want to create, the relationships you wanted to create. It kind of puts the onus on you. And I think oftentimes we want to be able to step into situations and have things kind of prepared for us. So even if you are in a place that has a lot of structure and you have a lot of support or a support system, like, who do you want to be in that space? How do you want to show up in that space? And how do you ensure that you're living with your values on a regular basis? Because people remember the moments that you spend with them, and people remember the interactions and what it felt like to be in your presence. They could forget everything you said, but they'll remember how you made them feel. And so, like, take a chance on yourself. That's what I would have to tell me. That's what I was telling me back then. And looking back, if I hadn't been taking those chances and trying things, even though I was scared and sweaty and gross and awkward, like, I wouldn't be here. And this is where I wanted to be, even though I didn't know it. And so I just think we all have talent we can kind of cultivate, even if we're not knowing where we're going, if we're not feeling ready. And to take a chance on yourself and be willing to put in the work. Like, don't just say, I'm a this now, without doing that kind of background, because you also don't want to get exposed, because people, they remember that and then they're not going to trust you. So I just think I had a lot of experiences, and from all of that, I would say, just who do you want to be and how do you take those chances for yourself?
Awesome. I appreciate you sharing that. And yeah, people definitely remember how you make them feel. So make people feel good, so they remember you and think of you in a good light.
Mm-hmm.
Okay, so you graduated and you went on to become a fellow/intern at Health Career Connection, and then go on to get your MPH at Boston University School of Public Health. Coming out of your bachelor's program, did you think you were going to get your MPH, or did you think you were going to go straight into career, or what was the thought process there?
So I got accepted to grad school on my birthday, which was January 26th, senior year. So I'm like, I'm going to one of these places because I got in. It felt like a big miracle and a culmination of all my hard work thus far. And that was like really special for me. Then it's like, how do we pay for school? We're figuring that out. I was also one of the schools I wanted to go to, they were like, you did not take a math class in college, so you need to take one ASAP. So it was me getting ready for grad school. I graduated, I think like the last week of May. I did not have a plan. I was going to chill all summer or continue working at the mall, because that's what I did. This whole time I've been working at the mall as I'm working at UMass Boston, because again, funds. So I got a call a couple days after graduation from the director of career services. from UMass Boston. He remembered me. He remembered how we used to do orientation together, the events I would put on with freshmen and sophomores, and the coordination like behind the scenes. And he's like, didn't you tell me you wanted to do some public health stuff? And I said, yeah, like, thank you for calling me. I wasn't expecting this call. And he's like, okay, so there's a program, HCC, Health Career Connection. They had young people, interns placed at Boston Public Health Commission, but they had to drop out. Would you be interested in interning at the city's health department? And BPHC is one of the oldest, it is the oldest health department in the country. I had been trying to intern there my whole undergraduate experience. I was like, yes, jumped at the opportunity. He said, show up at this time in a couple of days for an interview. And it ended up being 2 internships. So I was working in the Community Initiatives Bureau with a grad student doing like needs assessments for departments to see if they could work better interdepartmentally, which is a word I could never say. And then the other half was being the chief of staff's intern. So whatever they were working on at the time, like accreditation, to become a federally qualified health department, you know, doing lit reviews, health and all policies, which that was, as soon as I read that, health and all policies, I had to do a lit review. That's what I wanted to study in grad school. And so it just really prepared me for what does public health look like in practice, because I had no idea. And I got tons of exposure, but I do have to give a lot of credit to Health Career Connection because they're a BIPOC internship career connection program. And it started from a man who is Indigenous. I believe he's from the West Coast. And he had a mentor who was also Indigenous who supported him he's had a lot of career success. You all could look him up. And he started this program to be able to connect students of color with professionals of color. And as part of that program, they brought us to all different type of health and public health and like everything related to that organizations in Boston. They'd say, today we're going to this organization, this person's gonna talk, so-and-so is interning there, we're gonna learn about it, you're gonna ask your questions. Okay, next week we're going here. And throughout the whole program, they brought us all around the city. They also had social events and then career and leadership development workshops. So it was like boot camp for public health, medicine, all students of color. There was a whole group of us. It was actually a beautiful thing to see. And that really solidified like, yes, public health, but also not those kinds of public health. Like I wasn't excited about like, for example, public health consulting at the time because I didn't have the background. And also their job was really hard or things like that. So I was able to say, this is kind of my niche. We're gonna start here. And it was like the perfect primer that fate really brought it together. God brought it together. You know, I know people have different beliefs, but to set me up to go to grad school that end of August. So that was really special.
Yeah, that sounds like a really awesome process there from getting like hit up to come and do the interview, to be able to do that work and work around amazing other BIPOC people, as well as learning about health and all policies and how that translated into, okay, this is the kind of stuff that I want to do in public health, which is like very helpful going into grad school or going into any program if you're able, especially grad school, I think, especially because it's so short. Knowing what you're really trying to get at is just so important. Okay, so thank you for sharing that. So how did the MPH work? Because you said you got in, did you like defer and then?
Oh, so I had gotten, and they said, go take the math class. I did well in the math class. And class started in August. I was on the accelerated track. And so graduation's May. We have this intensive double internship fellowship thing going on all summer. Start class in the fall. And it really just kind of flew by. I was only in grad school for 16 months. So we had first semester was all core courses, things that I never thought I would be returning back to. But then we had a global pandemic, like population health or epidemiology and biostatistics. Those were not my background. Public health is a science. And for anyone who didn't study science as like a thing in undergrad, it's a different orientation. And then there's also public health writing, which is concise. I would also say scientific writing. So I had to learn how to be a public health student. I had to learn how to navigate public health as a science. And I was also going to BU School of Public Health, which is a teaching and research and practice school. So like they really lived their mission of living, teaching, and doing. So it was just very intense at first, but I think once I got a handle on, okay, so if this is where I want to be, this is how I have to get there. And that also helped me pick my, they had a couple weird names for it. Concentration, concentration, program of focus. I was health policy and law. That's what I studied. And then I had a sub-concentration in social justice, human rights, and health equity. And so that was like a culmination of everything I studied in undergrad. But BU is like a really great public health school. So I wanted to be able to, learn from the people who wrote the textbooks. And that definitely happened.
Yeah, that's awesome as well. And yeah, I appreciate you sharing your concentration as well. And that makes sense. I guess it aligns with everything that you've been talking to up to this point. And the internship with Health Career Connection was also with like Boston Public Health Commission, and you did that throughout your MPH too, right?
No, it ended. See, that's the thing. It was so short. It was only like 10 or 11 weeks of the summer between undergrad and grad. I thought I could have taken a vacation or relaxed, but I ended up in this intensive internship with the 2 internships at Boston Public Health Commission, and then being a part of the fellowship piece. So going to different organizations, getting all this practice, doing like your elevator pitch and helping us plan that next step. Luckily by then, because I was already accepted to grad school, it was less planning that next step and more of preparing to be in such a different environment. So I'll also say BU School of Public Health is a huge, it's on BU, it's at Boston University, which is a huge college, huge university, a teaching university, private research university, which is a lot different than my UMass Boston community, which was a smaller, still not small, like medium-sized public research university, just very different in terms of environment. And so I was really lucky to have those 2 internships, and they wanted to offer me a job after. They're like, so-and-so's position is open. And I said, I should really go get this graduate degree, because right now the position and other positions like it, they were only offering like $35,000, $40,000 a year. That was not gonna work for me. And so I was like, I need to go to grad school. And I know it's weird because a lot of people are saying like, oh, undergrad to grad, like you don't have enough experience. I don't think that's true. I think if you're able to get in, go. But also, I think I had assembled so many experiences along the way that I actually did have enough experience to say, we're going to actually put a pause on this and go get this education. And, through that, you have to do a practicum or like an internship component. And so I was able to do that as well. And then at the end, as soon as I saw, oh, I have 3 months left, it's October, I think 2018, we have to figure out where I'm going to work. So then it was, how do I get this career? Because I just spent the last 14 months in school and doing the practicum. And like, I want to go back and work at Boston Public Health Commission because they have a great mission. It's like to protect and preserve the health of Boston residents, particularly those made most vulnerable. That's not verbatim, but that's basically what it says. And so I wanted to get back there. And I wanted to get back there at a level where I'd have the budget and the support and the resources and the kind of connection or influence to like do work that made a difference. I think I knew where I wanted to see myself. And so that's how I was able to make that connection of, okay, I'm just here to get this education as a temporary thing. And we're going to go back there and we're going to find our spot there.
Yeah, absolutely. And I think you having that vision for yourself helps you to pull yourself into those types of roles and wanting more for yourself as opposed to like just letting life happen. Because as you said, like you could have taken that $35,000 job, which I don't know how you'd survive in Boston on that kind of salary. But you could have taken that job and been like, okay, I'm getting paid and then I'll follow up on school later. But you really knew what you wanted to do through all these experiences, through these informational interviews, through this fellowship to really solidify, okay, well, 35,000 isn't really doing much for me and I want to make this certain impact. So let me put myself in that position and get those experiences to really be able to get in where I would like to be and then grow from there, which I mentioned in the beginning of the interview. Like I think your like trajectory is amazing. I just looking at you.
No, thank you. But I think for me, it was very chaotic. Like it didn't feel like, looking back, I'm like, wow, I'm powerful. Like I manifested this. But when I was in the moment, it didn't feel like that. Also, you could ask my mom how many times I wanted to drop out of college. Like first because I felt purposeless, then because I'm like, oh, I can't get into these schools, these elite schools. And a lot of my peers, because I like stumbled into the honors college because they had the classes, not because I thought I wanted to, work harder in college. So I'm like, now I'm in the honors college, like it's within reach. Like I could try to do these things. And so my mom would say, look, you got to stay the course. She had a whole poem from Jamaica when she was in school that she used to make me recite to her about, the people who work hard and the people who don't, and they all, you have to get where you're going by working hard. And I'm not going to repeat the whole poem because it's long, but she'd make me say it all the time. And every time I'm going to quit, I'm like, but the poem my mom says is I need to do this because she's telling me, and I agree with what she's saying. It's just hard to do it. So it's a lot of credit to my mom, who was like, you're not going to quit now because you're getting so far. And my dad's saying, look at what the people who are successful, what are they doing? What skills can you pick up from them? And I think those are the skills that they learned, trying to assimilate to this place, which is very different from where they're from. And I wouldn't say they're like the most successful people in life, but they were able to do everything they needed to do and more. And so thank them, because to me, it was just chaos the whole time.
Fair enough, fair enough. Well, shout out to mom and dad for really helping and supporting you throughout that time. And I think that speaks a lot of volumes to a lot of students, especially like first generation students going into these environments and feeling that uncomfortability from everything that's going on, and it being hard and being like, all right, this just isn't for me. But to the point of like, that's just an imposter syndrome of like, okay, I'm becoming the person that I want to become. I'm doing the things that I need to do. This is uncomfortable for now, but if I keep on doing it, it's going to become okay. It's going to become my normal, and I'm going to feel okay in this. And like having those people around, whether that's your parents or friends or partner or whatever the case might be, to really tell you, hey, you're fine. Just keep going, keep your head down. Like to do and to be and do the things that you want to do is going to take hard work, and you've made it this far. Just keep on pushing. So definitely shout out to them there. And then there's another thing I know you mentioned earlier in the interview, that you were from a predominantly white town, I think PBD.
Yes. Yeah.
And then you said it was interesting going to UMass and now BU. What was like that transition, or how was that like transition from those different places for you?
You have a skill at this, okay? So you have a skill at this. I grew up in Peabody, Massachusetts. I would say it's a town, from what I remember. I know it looks a little bit different now, but it was all white people. It was mostly, that's not the case now. It's a little bit, just a teeny bit more diverse. But there were a lot of European people and people who were descendants of European people, like, oh, my great-grandfather and my grandfather is from this place. A lot of the people in Peabody, my classmates, like, oh, so-and-so's dad is in charge of the fire department. So-and-so's mom is the police chief. So-and-so's person owns that gas station. Like, it was so very, like, everyone's parents owned businesses, and it was seen as like this, like a really great place to live. And my mom wanted to move there because my grandfather had first come from Jamaica, and he had got a job at a factory or a tannery or something in Peabody. And this white man really liked him, helped him bring his family here, including my mom. But my grandfather wasn't allowed to go to the bathroom in Peabody. He wasn't allowed to be out at night in Peabody. He couldn't even go into a store to buy water. And so my mom's whole thing, she told me as I got older, was I moved back to Peabody because I wanted to own a house in a place where my dad couldn't even get water, couldn't even go to the bathroom. And so, yes, everything comes back to racism and xenophobia. But I think for me, I was one of only 2 Black kids in my entire elementary school. Like, I was one of maybe 6 in my entire 6th grade class, and there were hundreds of us. And so I think for me, it's like that assimilation to the point where it's painful and you don't even know who you are anymore. And then coming to UMass Boston and meeting people from all over. But I found that I naturally clicked with, obviously, my West Indian, my Caribbean, Central South American folks, my African folks, East African and West African folks. So just being in a place around people of color and people being authentically themselves, it like dinged for me. Like, I need to like find who my authentic self is. And that's been like a 6-7 year long journey. I feel like now is finally, I'm in that place where I know. But a lot of it was like personal wrestling of like, who am I? Like, what are the things I've been told to like versus what are my true interests? Like, how do I see myself, and where is that internalized anti-blackness? Like, these are things as people of color, BIPOC folks, you have to work on. It's not just gonna go away on its own. Like, so for me, it was like a long period of like figuring that shit out. Sorry, figuring stuff out, and then
You're fine.
going to be okay, good. Because I swear a lot, so I'm really surprised. Like, we made it more than an hour. This is the first one. So I think for me, like going to BU School of Public Health, that was the hard part for me, because I was so grateful to be in such a place that's so amazing. And obviously without them, I would not be where I am in my public health career. I will say the first day of class, I had a backpack that I bought at Target. I was famous because I worked on campus at UMass Boston for never having a backpack. So I would just go leave my stuff in my office or so-and-so's office. Like, I didn't need a backpack. I bought a backpack at Target like the day before class. Like, ooh, I should have somewhere to put my books. And this girl was like, "Oh, where'd you get that bag?" And I'm like, "Target. Like, it costs $20." And she's like, "Oh, this is a designer bag." So she has a designer backpack. And then like another girl's like, "Oh, my car is in the shop and my mom made me take basically her rust bucket." And it was like a brand new Range Rover. So that was just very jarring for me because I wasn't ready. And then a lot of my peers, there were about maybe 8 Black and Latinx students in our cohort out of like 70 people. And so we were all spread out. No one was talking to each other. And by the 3rd week of school, I'm like, I'm not going to make it if I don't start making friends. So I would just walk up to them and be like, "Hi, I'm Alyssa. I'm Jamaican. I'm Ethiopian. Like, I'm here. I'm studying this. Like, what are you doing?" And slowly we all became like a little community within the cohort. And so for me, without that group, and I would say there was another group of TAs who were also BIPOC students who I connected with in various classes. They're the reason I made it. I would not have made it without them, because the environment, and then it was hard, and it was such a shift from, like, in philosophy, I could sit there and say, "Here are every single option to solve your question," but at the end, I still don't have an answer. And in public health, it's like, you have 700 words and I need the entire argument and citations. So it was a lot of transition for me as I'm doing that personal self-discovery. And that was hard, but having a community really helped, remembering my purpose and why I'm there and my values, and, acknowledging wins, like, "Oh, this time I did do the poster the right way," or "This time I did use the automatic citation function and it worked," or like, you have to take the little things too, because sometimes the bigger things can feel really heavy. And it's like, we'll come back to that in a little bit. Like, my future self will handle that. Today we're gonna focus on the fact that we like did a good presentation and we're gonna go to sleep.
Yeah, okay, that's
Mhm.
awesome. And I love those insights, and I think that and you sharing that is going to be helpful to other people who might be navigating similar situations, because yeah, that's very important. And I think that self-reflecting and really understanding our own implicit biases and where we're standing on different things is not something that we actively like are forced to engage in, but it is so like beneficial for us just realizing where we are and like what beliefs society has put on us as opposed to like what we actually believe for ourselves. So yeah, and shout out to cohorts that stick together and that you're making friends with, and then that they're able to like help you, because I think that, just as we spoke earlier, like having that community is a huge part of health, and as well as again through an MPH program, for sure. Okay, so another position that you had during your MPH was a graduate assistant at the Sexual Assault Response and Prevention Center at Boston University. So tell me a little bit about that experience.
Yeah, so I got to BU SPH and I needed a job. And I'm like, how do I do something that I'm passionate about that's going to lead towards where I can see myself going? And at this point in time, I was more trying to collect skills. And then I knew I had different areas I was passionate about. I had had several friends who had instances of who had experienced sexual assault and things of that nature. And they were trying to cope in their own lives. And I thought, this is a really important thing that like people don't know about. And we're on a college campus. These things come up all the time. And I'd rather have information and be able to share it and provide it in a way that feels accessible and tangible when people don't need it. So when they do need it, they know where to go. But also, part of that job as a graduate assistant, it's fun because we got to do prevention work. And so I've always been a fan of prevention, giving people information, letting them make decisions. I'm a prevention person, all forms of prevention. Prevention is like a thing that can be three different areas. There's upstream and downstream. There's direct care, there's things that are like intermediary. And, it's really important that we understand how the different forms of prevention work together. So I was doing a curriculum, facilitating a curriculum that, it was called Sex is Like Pizza, but really talking about consent, but we're going to create pizzas together to talk about, with college freshmen, what is consent, how to initiate and stop consent, and what can you do to have conversations that could feel kind of awkward, and making it around the pizza party. And at the end, we'd buy people pizza, or we'd make really cute things like consent buttons, or just trying to find fun. We had like a whole thing like Sex in the Dark. It's a panel about like sex toys and lube and things that people don't talk about. So they have the whole auditorium dark, and the panelists are the only people you can see, and they answer students' questions. And so I thought it was a really unique way to reach students where they're at, because they're seeing Sex in the Dark like, ooh, what is this going to be? And like giggling and nervous and thinking it's going to be something raunchy. And then they actually stay for the information. So I think that was one way of meeting a completely different audience where they're at, and gave me a lot to think about as I went further in my career.
Yeah, that's awesome. And I think there's a lot more work to be done around consent on college campuses, and sexual violence and domestic violence on college campuses. But yeah, definitely very, very important work, and appreciate you doing it as well. And then you had another job or internship, I should say, as a patient advocacy intern at the Dimock Center. And this was your practicum placement, I believe. So tell me a little bit about that.
Yeah. So during my time at BUSPH, like that first semester was all those core classes. Second semester is the first time you're taking classes in your certificate. So I was taking policy making and regulation and planning. And these classes where I'm writing these long papers and identifying stakeholders, drafting policy. So doing a lot like policy development work, doing presentations on issues and stakeholder mapping, how we're going to reach different groups. And I'm realizing like the people we're even talking about, they're not in this room. They're not in this audience of us as students for the most part. My professors do not know the people we're talking about. So I want to make sure that, because I can rely on my own experience, but I'm not everyone. I'm like the whole danger of a single story thing. So I'm like, I want to work directly with people who are coming to receive health services at a health center. And Dimock Health Center has been around for a really long time. And they provide services that I wouldn't say other health departments don't, or not health departments, health centers don't. I will say that just the foothold they have in their community it's tremendous. And so I saw an opportunity there to work as a patient advocate. And I think the most important part of that job was our whole role is to identify patients' social determinant of health needs. So instead of me sitting in a room reading a policy and saying, I wonder what people think, or how is this going to meet their social determinants of health needs, I was in the health center doing case management with families, and they would come there for all different reasons. Someone's having a primary care appointment for their young person. I go talk to the young person. Oh, they need resources as it relates to getting youth summer jobs. Great. But while I'm there, the mom is saying, like, admits that she doesn't have enough diapers at home, and she's really looking for ways to get diapers and clothes for her new baby. That's something that we also do. So now I get to connect her, to give her what we have in stock and connect her to places where she can get diapers and food and things of that nature. We supported around folks who needed their electricity bill like stopped or paid, getting folks furniture for new apartments, folks who are really just having a hard time, because you don't think about it. Sometimes when you're working in these kind of roles, it's the worst day of someone's life when they're coming in to see you. And so the way you present yourself, the way you build a connection with them, the way you're not stigmatizing, the way you could provide like a non-judgmental space, that could be the difference maker. And does this person open up to you and say, actually, I am struggling with this, or, I did have my abusive partner burn down all my stuff and now I need all new stuff. How do I even start? And I had so many clients who were in those type of situations. And so that was just a formative experience, because it kind of just closed the gap for me between practice and policy. So I think I was that person in class who would say like, but what about how does this affect this community? Or how does that affect specifically Black people in Boston? And it's like, oh, well, we're talking about everyone. And I'm like, no, but let's talk about them because it doesn't seem, what's an unintentional consequence or harm in this situation? And it always got quiet, or we moved on, or we got into an argument. So even though that wasn't my intention, like in the policy program, that became my thing because it's like, how can we not do this? And I realized that that's not what they're there to teach.
Yeah, I think to that point, just making sure that we have those people who have those experiences and who we're trying to like make decisions around, making sure that they have their voice and they have a leg in this, in whatever it is that we're trying to do. Because as we said like earlier, the status quo is just going to continue being the status quo unless we actually actively push against what is there to change it. And yeah, shout out to you, and hopefully a lot more students are like you and calling those things out, because I think it is important. And I think especially like as a lot of more programs are shifting towards like health equity concentrations, and I have air quotes there for anyone listening, like that's just a marketing tactic in my perspective. I haven't seen anything from the curriculum or anything that is like really, oh, this is really like health equity focused. So I'm guessing that you're even going to be having to ask the same questions, because it's not something that is really taught in the best way as yet. But hopefully we can get there and really ingrain that into public health, and especially public health schooling, so people can get like a great yeah.
I just want to say one more thing about that, because I think for me, we were in a class, I think in the core classes, I think it was population health, and they're like, why don't public health interventions work? And I think I had not focused that much on that, because like I said, I wanted to do more policy stuff, but I wanted to make it practical, which is why I went to Dimock Health Center. And then I'm like, okay, I still don't know what I want to do as a job, but like something's missing here. I remember our professor's like, oh, so this organization got this amount of money to open this type of intervention in this neighborhood for this group of people who've been historically marginalized. But they only offered services at times where people who were working weren't free and they weren't allowed to bring their kids. And they're like, how come we spent millions on this intervention and it didn't work? And to me, I'm just sitting in class like, this is dumb. You're telling me this happens all the time? And then I realized that that's the function, like what you're saying, the status quo. Like that's what we've been designed to do, is to like apply for and accept funds, and just whether or not the service is necessarily most beneficial, we're gonna do it. And so for me, that like lit a rage inside of me. So when I went to work at Boston Public Health Commission, I'm like, everything we're gonna do, it has to make sense. Like we're not gonna do stuff that like we're wasting our time. We're hemorrhaging trust. We're doing all of these things that if we're not doing what we say we do, like we're fake. How are we gonna be fake? Like I'm trying to hold you accountable to what we say we want to be, thinking specifically to health equity. Like we can't just use that as an empty phrase. That phrase means something, and it's not everything, but it means something. So we can at least own up to that if we're gonna say it, or we're just expecting for people not to know what it really means. So that's where I have rage.
Yeah, and I think it is right to have rage, because it has gone on and it continues to go on, and until we speak up and until we take up space and say these things, is definitely not going to change. So I appreciate that. And then I think is another question that I'm going to ask more around this in a little bit. So you come to the end of your MPH program. Were there any other takeaways from your MPH schooling that you wanted to share?
I would say I chose to go to BU School of Public Health because a lot of the people that during my internships or when I was doing informational interviews, they also went to BU School of Public Health, or one of their colleagues, or they had a favorite professor who worked there. And so I just think it was a great place to launch my public health career. And I do have to say that the policy program was really good. I learned a lot about how do we creating plans. I think we don't spend enough time doing planning and like being intentional about next steps. And so even though I didn't end up going into a career that's policy, like I'm not a policy analyst. I don't analyze policy. I don't sit in Excel and see which policy is going to be more cost effective. That's not what I'm passionate about, but I learned how to do so many different things. It's really funny because when I ended up working at the commission, my second job there was managing a federal grant. And one of the biggest projects I did in grad school in the policy program was to write a health and regulation plan to support people impacted by the opioid crisis, because that was really big in Boston at that time. We're still kind of dealing with the impacts of that. And so taking something so relevant, it literally became my job. My job was to implement basically the plan I had drafted in grad school. So it just goes to show, like, when you're studying things that feel super practical, you can make them like come to life. And I think it's important to research the things that we want to do, because research isn't everything. We know research has limitations, and the ivory tower and those things. And there's still good stuff in there. And then also we need to meet with communities and see what's needed, and how are we mixing those things? How are we not just juxtaposing them, but instead weaving them together to create the best possible intervention or outcome, versus saying like only research or only practice. So BU taught me a lot about the planning and the research pieces. I feel like that was the cherry on top for what I wanted to do next. So it was great.
Awesome, awesome. And yeah, I think like just having more community engaged research processes is very helpful and very informative, as well as holds everyone accountable to what is going on, and sets like realistic and impactful like indicators or metrics to shift work forward. So yeah, appreciate you sharing that. Okay, so you graduated and then you went back to Boston Public Health Commission, and you started off as well, after your internship, you started off as a training coordinator. So what was that process like getting this job?
Yeah, so I worked in career services during BUSPH. I was the resume person in the career services office. So if anyone wanted their resume checked, application for a fellowship reviewed, to do a mock interview, they came to see me. So I was like, I need to use these skills that I've learned through working at these jobs to help me get the career that I want. And so something I'll say that is useful is I have an Excel spreadsheet, and not because I'm a big Excel person, but name of the job I'm applying to. Did I submit a cover letter, and what version? Because you have different versions of your cover letter. You mix and match to tailor it based on your skills. Come on, y'all, 2022. So then it's like cover letter, and then did I get an interview? How did it go? Any notes I have? Any research I'm doing? I had a little notes section. So I just made myself a little grid, and I found jobs. I wanted to be very, as you probably surmised by now, mission oriented, as well as doing things that I believe I had the skills to do. So I looked at Boston Public Health Commission. I had a lot of open jobs at the time to do a lot of different kinds of public health work. So I picked topics I was interested in. So this position was working a lot around equitable anti-violence strategies, working with nonprofits to support them and meeting their clients' best needs as it relates to them experiencing some form of harm, whether in the community or in relationships, or other forms of harm that people can experience. So I'm like, I could do that. I like, based on my previous experience, something I feel confident about. It's something that's important, that I find meaningful. And so I applied, and luckily I got the job. But I will say, I applied to a couple of places and had a couple of offers at the same time. Negotiation is important, because I was able to negotiate $8,000 more by saying, so-and-so gave me this offer. It's the same thing, but I really want to work for you. And even though that doesn't work in every situation, I just want to remind folks, like, you have power to negotiate. And if I hadn't worked in career services, I would not have tried that. I would be worried to lose the offer. But I think every position I've had, I've negotiated. And it's because there are skills, there are workshops, there are skills, and there's people you could locate, whether in a college setting or outside of it, that could teach you how to do negotiation in ways that feel safe and comfortable. So I had the job offer, I think the first week of January, and I started the second week of January. And so right after school, I didn't take a break. I should have, looking back, but I didn't. Breaks are important, but I did start right after. And so I felt kind of successful in doing that, because I'm like, yes, this is it. But that's a whole nother transition. It's school to working. Very different. It was hard.
And what was that transition like for you?
I think it's one of those things where it's like you think you know exactly what you're stepping into, because you hear me, I'm passionate, I'm young, I'm bright-eyed, we're gonna come do the thing. And it's like the people who've been doing this, they're a little jaded, they're tired. Some of them might be close to retirement. And I'm not saying that in an ageist way, like literally they're actively planning for retirement. There's people who they don't believe in this work anymore. but this is their job. And so to do a job that's kind of in that workforce development space around training, we did training as it relates to trauma-informed approaches and resiliency building and providing safety and healing for clients, and understanding our role within our organizations and institutions to promote people's health. I think, how do you meet people who are burnt out? How do you meet people who've been doing 3 people's jobs, but there's no money to hire a new person? So just the reality of working isn't this kind of like idealized thing you think about in school. It's like, no, there are some realities and some limitations and the politics of it all that get in the way of you being able to do what you want to do and what you need to do. But I think for me, that let me know that it was a choice. Like, you can choose to be great at your job. Like, you can choose to put in effort. I'm not saying way too much, but you can choose to live your values, or you can choose to coast. And so I decided that I was going to be a person that, if we're going to do this, we're going to do it what we consider to be in the most equitable and trauma-informed and, anti-oppressive way possible. Part of being in public health, it's a science. And what do we do in science? We're looking for the best practices. That's the same thing when you're trying to do this kind of work. You're not always going to do and say the right thing, but how could you be humble, and how can you learn, and how can you come back? How could you repair relationships and trust? A coming back part is important, because you can't just mess up or, not do what you say you're going to do or not follow up. And there might be a great reason for it, and you might be under pressure, but then that's a relationship that's damaged. So for me, it's like, that job really taught me humility, and that transition taught me humility.
Yeah, and I think that's very important, especially in this field of public health, like especially like during the pandemic, like realizing that it is a science, things change, we learn new things, whether that is from data, whether that is from conversations or other like quantitative data, I should say. And you have to be okay. You have to like be humble enough and realize that, okay, we don't know all the facts all the time, and things change, and being able to change our mind and pivot is okay. And I think that's something that a lot of us don't really understand, but it is important. But thank you for highlighting those as well. Okay, so after your training coordinator position, you either shifted or got promoted two more times. So I'm going to say you're a program manager, then you were a senior program manager, and now you're associate director. Was this like intentional or
no?
No.
No. Okay. I could say more. So I have to first preface this with, as an employee of the health department, I technically work for the city of Boston. And so anything I'm going to say as it relates to these roles and the work that I did, these are my personal opinions and experiences. They do not represent my employer or my lovely colleagues. And yeah, I'm just, every time I'm speaking as Alyssa, not as an employee of Boston Public Health Commission. So as a training coordinator, I just wasn't really in the best situation I could be in as it relates to like a workplace environment. I think it's really important to have a supportive supervisor, or at least someone who's invested in seeing you and giving you opportunities to build and grow your skills, especially someone as like youthful and excited as I was. And so after about 8 months, I realized like, this isn't really an environment I can grow in. Like, I can stay here and I can do this, and I find it fulfilling, but I want to grow. I want to have a chance to build off of some of the skills I learned in school or in previous positions. So a position opened up because we received some grant funds and from the Department of Justice. And it was to do an opioid prevention program in collaboration with the folks within my job who work in recovery services. And so I was the program manager. It was so cool because, like I said, this was what I had done as a grad school project in a class. I wrote like an 80-page paper on this, and now it's my job. So we identified stakeholders in the community. We invited them to join a coalition. We did a survey because the pandemic hit the month after I started this job. So it was, we can't do all these things in person, but we need to still do some data collection phase and then launch an implementation plan. And the feds don't care that it's a pandemic, because also the pandemic wasn't everywhere at that point. The pandemic was it was happening here in Boston really badly due to Biogen and things that had happened here, but it wasn't, people weren't scared yet. So we're over here saying we really need to make sure that we're taking the best care possible. So we went virtual. We had this coalition. We did an online survey, 96 young people filled it out. We did we did focus groups. We taught young people to focus group other young people with myself as the facilitator and other young people as the facilitator. So that was really cool. And that strategy actually came from a colleague of mine, Dr. Linda Sprague-Martinez. She used to be the dean of, not the dean, she was the chair of social work, macro social work at Boston University School of Social Work. She was the consultant doing evaluation with us. And she just allowed me to see what is possible as it relates to designing programs, collecting data, working directly with Black and Brown populations, BIPOC folks. Her whole thing is community-based participatory action research. So I got to see it right up close. And so I really, we were partners in this work and building the implementation plan. We ended up using quality improvement tools to narrow down everyone's ideas into things that were feasible. And we prioritized the community feedback that we got. And so the community really decided the plan. The community and the key informant interviews we did with providers who serve the people in those communities, they said, this is how we want you to spend the funds. And so we did, and we made it happen. And so I think that's something I'm really proud of, because for me, that was that disconnect of, well, it'd be easier to do this, or other people have done this. And I'm like, no, we're going to do something innovative. We're going to do something with the community. We're going to be partners. We're going to give out funds. We're going to fund people who are already doing this work. We're going to put money in young people's hands during the pandemic, which was one of the scariest things that any of us have ever lived through. So also remember that people are professionals and they're personally impacted both at work and at home by the pandemic during that time. This is so scary. And so we were not only doing the work we needed to do, but ensuring how are you doing? Do you have the support that you need? Do you have access to food? A lot of folks were struggling with access to food, early in the pandemic. And so being more multi-resource and then giving people information about COVID, because even though that wasn't what I studied, and we have entire departments that do that, folks were redeployed, I avoided redeployment to continue to ensure that these funds reach the community. I was one of the few people who wasn't redeployed to work on pandemic response. And so I tried to weave pandemic response into the work to ensure that, I could still support my colleagues who were working tirelessly, and especially in the beginning, to ensure that people had information about testing and how they can keep themselves safe.
Yeah, absolutely, absolutely. And what was the shift like from program manager to senior program manager? Was that a much bigger, heavier lift? Was that something that you were looking for, that active promotion around? What was that like?
So I'm gonna say a couple things. So as a training coordinator, you're a coordinator, so you don't really get final say on things. Just, workplaces have a hierarchy. That's cool. As a program manager, I had a lot more influence over the purview of my work and how it happened, the approaches we would use, the frameworks we would employ. That was really great. While we had that program, if you've worked on a grant, or even if you don't, you might know that grants run out of money. They're not forever. And so we were trying to find ways to make this program sustainable, whether through city funds or other grant funding. So while I was a program manager, our team, we applied for another grant from DOJ. We eventually got it, which was great. And we got a CDC grant. And so now with all these new grants coming in, they all have their own kind of scope of work that's related to this project, but also bigger, because this project didn't need to be this big, but we made it big because that's what I wanted to do. And now we have all this new grant funding. We don't have enough staff for all these projects. I went to my supervisor and I'm like, hey, I know you want me to run one of these or really support in leading a main part of this and putting me on the grant management team. I think I should, get a title change and some more money, because now there's more money to go around. And so I kind of planted that seed as soon as we got the funds. And so for her to advocate to leadership for me to get this raise because of the work I had been doing as a program manager, it was very significant and quite an undertaking for her. But she made it happen because she really believed in the work I was doing and my approach to this work. So it ended up being a promotion, but it wouldn't have happened if I didn't say hey, my workload is going to be this much larger and you're asking me to do more work that requires more skill and intentionality. And for me to devote my energy to it, I'm going to need some dollars. So that's really how it happened. And we were in supervision and I said that, and a couple months later, I got the promotion.
That's awesome. And I think that's important for people to hear too, because yeah, like you're seeing like these different things coming on. You're seeing that more responsibility is right there. You're seeing that there's more funding there. So like, you know that you're doing a good job. So why not advocate for that? Shout out to your boss for like believing in you and like going through those rungs to actually get that done for you, because that is also very telling as well.
I know, can I say one more thing about her? Because she's awesome. So when I was a training coordinator, she saw that I had skill. Like she's the one who said, we have this job opening, you should look into it. And when she was my supervisor, oh, like now we have to have contracts. We are gonna have contractors for this grant. She's like, I'm gonna write the contracts the first time, but the next time we need to do it, you're gonna write it and I'll edit it. So anytime there's an opportunity to do a new part of our work, like, oh, the new grant budget, you can go over it first, then I'll cover it. We have to we have a monitoring visit from our funder. I get to take the first stab at it, and then she would review it and write her parts. And so going back to what I said about being the training coordinator and not having support to grow, I think it's important that we find environments that not only are folks giving you opportunities, but they're not hanging you out to dry. Like she had my back. If I was trying to work on something and I was really stuck or having a hard time, I could go to her and say, I know you asked me to do this. It's my first time doing this. I've never like done this except for a homework assignment. Like, let's work on it together. And like, that was okay within our environment. And so I had to find a place that I could be able to try those things. And I got to do some like the quality improvement stuff in real life, qualitative, research, survey design, stuff as it relates to budgets and contracting. And I think the building relationships with community partners, like just taking the lead on things that were like running the coalition of 20 something organizations, all of that was because I had her and our other co-chair believing in like, oh, you have the skills, you have the talent, like we're gonna let you do this and we're here for you if things start going sideways. So it's really important to have supportive supervisors and senior colleagues who believe in you.
Yeah, and even like to further that, not even just supportive of people that are giving you opportunities to like increase your scope and like slowly do that while also giving you the support to help you out learning those things while also advocating and showing you that, okay, there's this new position opening and up here and things like that, which is awesome. But shout out to you. Shout out to you.
Mm-hmm. Thank you.
You shifted or moved it, well, you got promoted again into the associate director position, which you're currently in right now. So tell me a little bit more about that and maybe a little bit about what you do.
Yeah, no, totally. So I think the role I have now, I'm very excited about it. It was very heartbreaking to leave my last role because I really cared about the work, but this opportunity opened up. There's such thing called push and pull factors. And I would say this definitely pulled me from where I was at. And so I now work in the executive office in one of the departments that serves our job internally. And so I work for the Office of Racial Equity and Community Engagement. There I'm the Associate Director. I've been in this job now for about 3 weeks. I know what I'll be doing. I'll be leading racial equity and justice trainings, working on racial equity action plans for bureaus and departments, working in partnership with them to help them create the plans, implement them, evaluate them, working with folks in performance management or in human resources or, folks who are supporting the public health workforce. And so really designing opportunities for learning, but really my job, as my supervisor was telling me, is training to practice. How do we get from training to practice? Where do we get stuck from training to practice? So I'm the person that gets to kind of fill in that gap. And, there's a lot of great racial equity and health equity work happening within the health department. And so for folks who are doing it well, how do we support them? For folks who are trying and kind of in that storming and norming phase of trying to do this work, how do we support them? And then for folks who they may work in a department like who doesn't see racial equity necessarily as central to the work that they accomplish within their scope, it's still very important. And so how are we ensuring that not only is the work they're doing racially equitable, but that people feel confident to speak to these issues and speak to our mission, so it's embedded across everywhere and not just in programs or departments that focus primarily on like working with constituents or doing community engagement. So this is like a really big deal for me. And I'm really excited to be able to do it at this level. And I'm not excited because I think it's going to be easy. As part of working on those previous projects, the grants and the training, we also did organizational change nonprofits, hospitals, other organizations looking to become whether more racially equitable or more trauma informed. And change is hard. Anyone who's tried to make a change in their own life, stages of change, theory of innovation, we know that change is really hard. And so how do we make small tests of change that aren't going to like crash the whole job? How do we, meet people where they're at and give them information so they can also support, their own colleagues in implementing the goals we want to see? And if that's not what you're down for, maybe it's time for you to do something else. But I think it's really important that we know why we're here and what we're doing. And so it's a promotion, it's a big deal. I'm excited about it. And I know it's not going to be easy, but there's a group of us who are doing this work and we really care. And, the policy window is open for this. It's time to hold people accountable. I think before it was like the nice thing to say and do. We're going to update our statements. We're going to do this. We're going to do that. So now let's do it. Where's the action? Let's be accountable. So that's me.
Exactly. Okay, I love it. I love that. Congrats again. Look forward to seeing you like fill out into this role and really develop your own style for doing that. That's really dope. And shout out to you. So the question I wanted to ask at first is, what advice do you have for public health student coming out to grad school to get a job and just get like those promotions and get that upward movement in their career?
Great question. Okay, so one, I'm going to circle back to something you had said earlier around imposter syndrome. I do think imposter syndrome is real. I also think that at a certain point, we're no longer imposters. These environments weren't meant for us to be here. When I say us, I'm really talking about BIPOC folk or people with lived experience and the issues that they're now working within. And so the advice I would give folks is do your research, do informational interviews, find where you're comfortable, push yourself if you're comfortable, because if you're comfortable, you might be a little relaxed. And in reality, I think we all have a passion we can tap into. And not that work has to be everything, but you want it to be something that you're passionate about, that you want to show up to. And so you have to do some legwork as part of that. Most people don't know what they're going to do right away. So how are you identifying opportunities or individuals? Or I found out about public service loan forgiveness because a friend said, hey, I'm going to this event about like city jobs. Do you want to come? And now through my role, I'm trying to get public service loan forgiveness. Is it going to happen? We don't know. But take opportunities, take risks, and take chances. And I know some people might not have like a safety net. And so be mindful of when you're doing it and be intentional. But it's possible to kind of take risks and show interest in things you might not have thought were interesting because you never know where it could take you.
Yeah, absolutely. Great advice. Okay, and then other thing that I'm going to bring back up from the beginning of the interview that people are probably like, oh, Omari probably forgot about that, but I did not. So earlier you said in this role, and in your role, you speak to like white supremacy and everything like very directly, which I think we like in my organization, we also do that everyone's pretty cool with that. It's like part of our culture, but that is not the case in a lot of places. How did you get comfortable being able to speak up like that and take up that space?
That's a great question. Basically, I realized it was like kind of being in class again. No one's going to say the thing. No one's going to talk about the root cause. But now I was surrounded by people who are saying, no, we understand the root cause, but then that's not connected then to what we're doing. If you understand and we understand, we're on the same page, we should be working towards shared outcomes of addressing, identifying, removing white supremacy and white supremacy culture from the places that we're at, and like decolonializing our perspective and all of those things. There was a time really early when I was still a training coordinator, we were supposed to like plan this event. And I said, we should talk about racism, health, and white supremacy for the presentation. And it got approved because people said they wanted to hear about it. And then the day before, my presentation got canceled. And so that made me very upset. And people in leadership were like, ooh, who's Alyssa? Like, we don't want her doing this. But my colleagues, they wanted to talk about it. So they came to me like, are there ways you can still do this? I know you do those trainings. Can I come to your trainings? And so I realized like there was an appetite for it, even if people in power, people who are decision makers, this scared them because they knew the more information people had, they would want to see structural change, both internally and externally. And that's terrifying. And so once I realized that that could put fear in people, I realized that that's going to be my role. And if someone else is saying it, or if I'm not in a position to say it because I'm in a more vulnerable spot, I have to support them when they're standing up. So it might not be me today. It's you. You start speaking. I'm going to start putting stuff in the chat. I'm going to come off mute and say, I agree with him. I'm going to say, so-and-so, what do you think about this? I know we were talking about this the other day and really bringing it into the spotlight in a group way, because some of these topics, people will try to break you down, but when you're standing as a group of people, it's much harder for folks to kind of nitpick and tear away. And so also one other thing about this, remembering that when you actually speak to people in the community, I don't know how many people actually still do that, but they tell you these are the issues. They might not put it in the academic jargon that we use, but they're telling me this is what's impacting them and white supremacy is impacting them. So it's not just me and my colleagues who are also residents. That's part of our role. But now I get to say, in this advisory committee that we all said is such a great idea to inform decision making, this is what the residents are saying, and they're saying this. So I think that just, sometimes you can't actually bring people in the room with you, but if you can bring their words, and you can bring their own expressions, you can record it, whatever you can do, that's even more powerful, because it's not just you, now it's the people you're serving. So it's very, very important to just stay attuned to what's going on, and circumstances change, so you have to continue to go back and to check in with folks about that.
Yeah, I really love that. And yeah, like be on the same page, or again, the community voice and actually listening to them. And then also like the point of you like making sure that the other people in your room that are experiencing the same things are on the same page, and as well as, oh, I agree with that, and actually stepping in to say that, because if they don't hear that, they're not going to think, okay, this is not something that we actually need to do, or this is just Alyssa doing her kind of really push against the system. Let's get her out of there, as opposed to like, oh no, this is more of what we need, because as we said, the status quo is comfortable, and to really make systems change and get to better outcomes, it's not going to be comfortable, and that's a hard reality, especially for people who hold a lot of power and are in a lot of comfortable positions there.
True.
For sure. Okay, so thank you for sharing that. Okay. So I think you were also a freelance independent consultant sometime during the pandemic. I believe that is. So tell me, how did you get into that? And then what kind of projects have you worked on?
So that's a great question. People have been asking me to do things for free since I was in college, and I've been doing them for free for exposure and to practice. And now I feel like I'm in a place where I can start charging for the type of work that people ask me to do for free. I will say many people have requested my services during the pandemic, but once we start talking about pay and sliding scale pay, people disappear. And so I think like there's an appetite for people to want, whether it's work related that I can provide related to career services, related to racial equity and racial justice, or being trauma informed, or anything like that, organizational change. But are they willing to pay for it? And are they willing to invest in something that they want to see? I think when I say yes, people are like, great, here's the details, I'll see you at this time. But as soon as you say like, oh, will this be compensated? Crickets, silence, no more emails. And so I think for me, I haven't worked on many projects because I keep saying like, no, I'm making a decision now to do things that are paid and things that I feel passionate about. So for me, it's going to be more of something that when I have the bandwidth and when I'm looking to do those kind of projects, I'm going to put myself out there, or if people come to me, but we have to be paid for our work. It's 2022. It's really important that people are compensated and compensating a fair wage. And I'm not going to do things that aren't paid anymore.
Yeah, I like that a lot, especially as we talk about like the wealth gap and different things like that. And as well as people want to talk about equity, air quotes again, people listening, they want people, oh yeah, come on my panel and speak on equity and on this and that, but you don't want to put out the funds that you would pay for like this white keynote speaker or whatever the case might be. But yeah, I think like it's important for us to advocate for that pay, and it is very helpful. We're coming in there, we're teaching, we're using our knowledge, not only from like lived experience, from our academic knowledge, to really inform things. So I think it is important. And I think in 2022, a lot more of us should be getting to that band. That's for sure.
Mm-hmm. And I will say, just quick caveat, if it's like a community-based organization or someone who we all know doesn't have the funds for this type of thing, that's different. I'm talking about the people who can pay. The people who can pay need to start paying. That's all I'll say.
You're not lying there. Okay. So before I move you on to the last section of the show, I'd like to ask you, where would you like to see yourself in the future?
I have no idea. I didn't know back when I started college. I didn't know in grad school. I didn't know now. I think for me, it's about identifying and building skills. And so, like, something I'm still doing, I'm trying to get a project management certificate. I'm getting an equitable evaluation certificate. I'm trying to find other learning opportunities that aren't as, intensive as school, or like a professional program, but something that I can gain a certificate in to expand, my knowledge and improve my own job performance and things I may do on the side. And so for right now, I see myself kind of stacking up more skills and refining skills that maybe I've only used a couple of times, but I'm trying to keep an open purview because I'm letting things come to me. It's been working. And so I'm going to continue to try to manifest the type of spaces I want to be in and what skills I need to be in those spaces, and whatever it's supposed to be for me will come.
Yeah, that's awesome. And I think that's absolutely fair. And I think this approaching school in that way as well, not even like just your career, but your school and your growth in school, like what skill sets can I gain? Especially if you don't know exactly what you're trying to do, gain skill sets that can be useful in a lot of different settings, and then you'll be good from there. So moving on to Furious 5, the 5 questions I ask all guests. Number 1, what advice would you give to a student trying to pursue a career in public health?
Know your stuff. Take public health courses if you can. Do your research on topics that you're passionate about. Is it access? Is it affordability? Is it epidemiology? Is it health promotion? Public health is multifaceted and interdisciplinary. And so even if you think like, oh, my interests don't fall within the sphere of public health, most likely they do, or there's some overlap, or you have transferable skills. In my grad program, I was a philosophy major. I was sitting next to an art student. I was sitting next to someone who hadn't been in school in 15 years. I was sitting next to someone who was an exercise health science person. And so just know that it's multifaceted. You can research the different areas, do informational interviews. Those are the things that are going to give you exposure, and try to get paid internships. You heard I had a lot of jobs. I did a couple internships. I had gotten awards or scholarships for all of those internships, or else I wouldn't have been able to afford to take time off to participate. And so there are ways to get your things funded. And I would suggest, trying to find or identify resources on or off campus to be able to do that. And pitch yourself whenever you can. Work on that elevator pitch. Someone I met at an event at UMass Boston, they came to a philanthropy event unrelated to me. And I was just saying, like, this is what I want to do as a career. Like, this is what I'm passionate about. The guy opened his briefcase, wrote a letter, because he also went to BU School of Public Health, and said, okay, I'm writing myself a note to write you a letter. And the very next day, he said, this person should be accepted to BU SPH. I don't know if that had a factor in my decision. I don't know if that had already happened. But he was willing to do that, and he was like a hot shot. So practice telling people what you want, because you never know. People are looking to support people who are passionate, interested, hardworking, and there's space and funds available for people like that. So go take it.
Absolutely. And a closed mouth doesn't get fed. So open that mouth. Number 2, if you're talking to someone wanting to get into your position, what advice would you give them?
I think for me, my job is very, like I said, I did the grant management stuff. I've done case management. I do training and organizational change. All of those things require a lot of different skill sets. And if you want to do these things, I would say start with one of them. Don't try to do all of them at once. I would say like training and facilitation, that's a skill. How do you talk to people? How do you work together? How do you create shared understanding? How do you create non-stigmatizing, non-judgmental spaces? I think that's really important. How do you use anti-oppressive language and ways that aren't performative? How do you bring training to practice? So I think it's really important to identify what skills that you want to build. And this is kind of related to my last question, but being in places where those things are happening. So, I'm passionate about health equity. I'm going to read this book. I'm going to go to this talk. I'm going to listen to this podcast. I'm going to do this, because that's going to get me closer to where I want to be. And how do I put that in my own words and acknowledge where I might not be understanding something and find the resources to fix that gap. But learning is a continuous process. I'm still learning how to get in my own position, because for me, it's important that we never stop that learning. We never stop that hunger and that growth. And so I would say just continue working on your craft.
Love that. Number 3, what's something you are working on improving in your life right now?
So speaking to what we were saying earlier on mental health, I'm a huge proponent in therapy now. I have a therapist. I go to therapy. I do my therapy assignments. I didn't know what it was before I was in therapy. I just realized I felt really overwhelmed and stressed and kind of angry and just not like, and like I said, I'm trying to discover my authentic self. And so I didn't have this watershed moment, but I was like, this is support. I need more support. How do I get access to that support? And so having a therapist really just helped me to identify what are my personal goals, my career goals, who am I, how do I want to present myself? I think encouraging positive self-talk versus I think I'm the type of person that grew up like, why aren't you this? What do you need to be doing? Or this is something negative and like you need to work on that. And now it's like, how do I talk to myself in ways that encourage me to do things and not like out of fear or punishment, but because those are the things that I want. So really working on myself in that way. And I said, like, getting these certificates, honing in on my skills and, making sure that every time I speak or correspond with someone, it's something that I would want to see represented elsewhere and I wouldn't be ashamed or embarrassed or nervous about it. So really putting effort into communication, written, verbal, at work, in my personal relationships, because boundary setting and communication, that takes you so much further and it allows you the space and the comfort to be your authentic self and be respected in the way that you wish to be respected. And so just a lot of growth, and growth is painful, growth is hard, change is hard. But for me, I really think like that's where I needed to be. And I feel like now I'm coming through on the other side of that just so much better. And I feel like there's light in me now. So I think it's really important to devote time to these things. So improving all over the place.
Yeah, love that. Love to hear that. Number 4, professionally, do you recommend anything?
Yes, the Finding Our Way podcast on Spotify by the person who was part of Black Lives Matter. I'm forgetting their name right now. I think it's Prentice. They interview all different professionals, people who've written books, people who do movement work, people who do clinical work, and they talk about what it's like to live through this pandemic, and so do their guests, and how that brings them closer to community, closer to their beliefs and how they practice those during this time. And I believe it's on season 2. So Finding Our Way, it's done wonders for me. I've cried listening to it. It can be really deep at times, but it's something that it's made a big difference for me in the pandemic and professionally as well, thinking about how we want to talk about the work we do. And again, avoiding that performative aspect and doing things that are meaningful. How do we make meaning of our experience?
Okay, awesome. I will definitely have to add that to my podcast list. So thank you for recommending that. And then last but not least, where can people connect with you?
Great question. I keep a low profile because I work for the government and technically that's just kind of how things are. But I do have a professional Twitter account and it's at Change Agent Casa, Change Agent, and then KASA. That's my middle name. It's Ethiopian. And then I started doing the whole LinkedIn thing because I think it's really important to network. And so you could find me on LinkedIn /Alyssa Benalfew, just my first and last name, or -Ramos on the end. Either one will bring you to my page. And I want to connect with anyone who's passionate about doing this work. I'm always open to talking to folks, what matters to you, or we want to talk about our careers, we want to network, because it's in those spaces we can really learn from one another and create meaning. And so I do one-on-ones with folks all the time, just to talk to folks about who do this work and who care. And so if you're ever interested in doing that, or like sharing posts or updates or events that you're hosting or opportunities to be a panelist, things like that, those are all things that I think, I really try to bring to the LinkedIn space. So that's me, pretty low profile, but a couple things to plug.
Okay, awesome. Well, I'll be sure to link those in the show notes for anyone that's interested. But thank you so much, Alyssa, for coming on. Really appreciate your story, really appreciate your insights, and I look forward to seeing everything that you could do going forward as you continue to develop these skill sets and just the work that you're doing. So thank you so much for coming on.
Thank you so much for having me. Thank you for reaching out. I think what you're doing is amazing. I think you are helping public health students and professionals every single day, and those aspiring to just do something, whether it's public health related or not. And so just big congrats to you. I support you. I would love to connect in the future if that's ever in the cards. And I just wish you a bunch of success and some peace as we're still coping through difficult times.
Yeah, thank you. And I'll definitely connect if there's some Ethiopian or Jamaican food.
We have to. Yeah.
For sure. Yes. Awesome. So housekeeping items, everyone. Thank you so much for listening to this and watching. Be sure to subscribe if you have not subscribed as yet. Leave a like if you're watching this on YouTube. Leave a 5-star review on all podcast platforms so that we know that the show is great. And be sure to share with a friend so that someone else in public health can get that help to navigate their public health career just a little bit better. And if you'd like to support, you can go to thephmillennial.com/support and find all the ways to support me there. Or you can go to my store or my website and support there and buy clothing or whatever there. Okay, peace out, everyone.